Assalamualaikum, we're back. So today we're going to talk about how is autism different from ADHD and speech delay. Let's start with the basics. What is autism, what is ADHD, and what is speech delay?
Now let's start with ADHD. So ADHD is categorized by the key diagnostic criteria of inattention, impulsivity, or a combination of both. We have overlapping characteristics that can often be confused with autism.
Yes.
So for example, difficulties with autism in maintaining a topic in conversation may seem similar to children with ADHD, who may appear not to listen during conversation or may appear easily distracted. Now let's look at the developmental language delay. These can be present similarly to children with ASD because both may demonstrate less interest in interactions or less integration of eye gazing. And however, in comparison with ASD, children with developed language delay demonstrate more pretend play skills and use of gestures. Being the primary caregivers, they spend more time with the child. They may have noted the delay in speech and language. Have another child with ASD, family history of communication delays. Hence, it's common for parents to describe their children's behaviors in various ways. So, for example, let's say a child who likes to play alone is a sign that the child is exhibiting poor social interaction, and this is commonly known as a repetitive restricted behavior of an ASD child. But for the parents, it's like, oh, they like to play alone on their own. Secondly, when we talk about speech and language delays, where it is misunderstood or it goes unnoticed because parents feel, I know what she wants or what he wants. So in this case, it is important to get other sources of reports, such as from other caregivers, in addition to clinical observations and the standardized testing to confirm the diagnosis.
True. So what are the main differences in the diagnosis process for autism, ADHD, and speech delay? Is there a difference?
Yeah, definitely. The key to diagnosing autism is that different diagnosis, any other diagnosis must not better explain the symptoms of ASD. I would like to highlight that when I say a comprehensive assessment for an ASD will include, firstly is the historical information, like I said, psychological and communication examination of the child. We need to also involve psychiatric examinations, which is the mental health, medical evaluation, and additional consultations.
Can children have more than one of these conditions simultaneously?
We call it as comorbid. We cannot deny the presence of comorbid. It's inevitable. You cannot avoid it. So some comorbid conditions with autism which we can identify, including the connections of autism with anxiety and depression. It could comorbid with OCD, obsessive compulsive disorder, ASD comorbid with ADHD. Autism is also comorbid with seizure disorders, which means it's fits basically.
How can parents advocate for their children if they suspect they have autism, ADHD, or speech delay?
So there's a situation we are talking about, like they really have to fight for the rights of the child, for the services, for the assessments, because the access is not as easy as we think it is. Right. So alternatively, they may be completely lost in the healthcare, the education processes, and then what happened? They disengage in the early years of the child life due to the barriers that they may experience. So this is especially true when it comes to decisions, surroundings, handling of families, the qualification criteria, the diagnosis and services offered for children with special needs.
Thank you so much, Dr. Chris, for today's sharing. It's very insightful, everybody. Until then, take care and see you. Assalamualaikum.